Alopecia is defined as the loss of hair and can occur due to various reasons. Effluvium refers to the process of hair loss, while atrichia refers to inherited hair loss. Hypotrichosis refers to congenital sparse hair, which is usually associated with syndromes such as Netherton syndrome and Rothman-Thompson syndrome. Netherton syndrome is an autosomal recessive disorder caused by mutations in SPINK5, a gene that encodes a serine protease kinase. Rothman-Thompson syndrome is a syndrome characterized by short stature, sparse hair, poikiloderma, skeletal abnormalities, and cataracts. Phases of hair growth. Hair growth occurs in 3 phases, namely anagen, catagen, and telogen. The anagen phase is the phase of active growth, while the catagen phase is the phase of follicular regression. The telogen phase is the resting phase when the hair follicle is not actively growing. Classification of alopecia by etiology and pattern. Alopecia can be classified based on its etiology and pattern. Congenital and acquired alopecia are 2 broad categories. Congenital alopecia includes diffuse alopecia, trichorexis nodosa, pili torti, and monarthrix, among others. Genetic syndromes such as Menkes disease and Netherton syndrome also come under congenital alopecia. Androgenetic alopecia, which is the most common cause of alopecia, also falls under this category. Acquired alopecia includes telogen effluvium, anagen effluvium, and circumscribed alopecia such as temporal triangular alopecia, nevus sebaceous, aplasia cutis congenita, and traction alopecia. Alopecia can also be classified based on the presence or absence of scarring. Scarring. Cicatricial alopecia refers to a condition where there is irreversible hair loss and scarring, while non-scarring alopecia is characterized by reversible hair loss without scarring. Scarring alopecia includes conditions such as Brock pseudopelade, which is seen mainly in women between the ages of 30 to 50 years, lichen planopilaris, frontal fibrosing alopecia, and central centrifugal cicatricial alopecia. Acquired scarring alopecia can occur due to viral diseases, mycosis, burns, chemical burns, among others. Non-scarring alopecia includes alopecia areata, telogen effluvium, and traction alopecia, among others. Diagnostics. The diagnosis of alopecia is often clear from the patient's history and physical examination. However, several tests can help determine the type and etiology of alopecia. Clinical evaluation includes taking a history that includes onset, pattern, history of inciting events, and family history. Physical examination of the scalp, hair shaft, and hair follicles is also necessary. Evaluation for systemic symptoms suggestive of underlying medical conditions is also important. Diagnostic studies include trichoscopy, which is the examination of the hair and scalp using a dermatoscope to visualize hair shaft, hair follicle openings, parafollicular epidermis, and scalp blood vessels. The hair pull test involves lightly tugging about 50 strands of hair away from the scalp, and if more than 5 strands are pulled out, the test is positive. The hair mount is a microscopic examination of the hair follicles and hair shaft to identify hair cycle disorders and structural hair shaft abnormalities. The trichogram involves plucking about 50 hairs from the scalp and microscopically analyzing them. Another diagnostic test that can be done to evaluate hair loss is a scalp biopsy. This involves taking a small sample of skin from the scalp and examining it under a microscope. It can help identify the underlying cause of scarring alopecia, as well as provide information on the inflammatory process and fibrosis. For congenital alopecias, there are a few specific types that are worth mentioning. Trichorexis nodosa is a hair shaft deformity characterized by the development of weak points in the shaft due to physical or chemical trauma or genetic predisposition. Pili torti is a condition in which the hair shaft is flattened and has multiple twists, resulting in fragile hair that breaks easily. Monarthrix, also known as beaded hair, is a predominantly autosomal dominant disorder in which hair shafts break easily, resulting in a beaded appearance usually a few months after birth. Genetic syndromes such as Menkes disease and Netherton syndrome can also cause congenital alopecia. Acquired alopecias can be caused by a variety of factors, including medications, radiation therapy, infections, and autoimmune diseases. Telogen effluvium is a type of non-scarring alopecia that occurs when a large number of hairs enter the resting phase of the hair cycle simultaneously. It can be triggered by stress, illness, or certain medications. Anagen effluvium, on the other hand, is a type of hair loss that occurs during the growth phase of the hair cycle and is often associated with chemotherapy. Traction alopecia is a type of alopecia that is caused by repeated pulling or tension on the hair, often due to tight hairstyles such as braids or ponytails. It is more common in women and can lead to permanent hair loss if not addressed. In conclusion, there are many different types and causes of alopecia, each with its own unique characteristics and diagnostic features. It is important for healthcare providers to be familiar with these different types of alopecia in order to provide an accurate diagnosis, an appropriate treatment plan for their patients. With the right approach, many cases of alopecia can be effectively managed, allowing patients to maintain healthy hair and an improved quality of life. If you found this video to be useful in your USMLE journey, be sure to leave a like to help out the algorithm. Share this video with other average med students such as yourself, and subscribe.